I would love to introduce Dr. Dayal. She is someone, not just a dermatologist, someone that I've trusted with my skin for many, many years.
So you say the scrubs should not be used during pregnancy?
Not pregnancy. I would say you should never touch it in your life ever. All those people who talk about how they've been eating only the ghar ka khana, they are the ones who are definitely getting all diabetes, hypertension, thyroid. They just deliver the baby and they are going to extract all the fat underneath jo skin hai, and then they stretch the skin down and put the sutures over there. Every other person around you will have B12 deficiencies, D3 deficiencies. अच्छा ये deficiency है, चलो ये खा लो, चलो ये खा लो. Non-vegetarian people have B12 deficiencies. Glutathione came into market as for those people who were chronic alcoholics. There was this one patient who came to me and I was like, चेहरे पे क्या लगा रहे हो भैया? He was, उनका चेहरा पूरा dark हो रखा था and he was like, madam, rinse साबुन.
How do you think the fitness impacts your skin more than anything else today? Because the first thing you asked me to do when I consulted you was to start running, do some physical activity, right?
Definitely. I think fitness means exactly you're talking about the exercise bit.
Yeah.
So I talk to my patient and I tell them all the time that whatever you put on your skin eventually is basically everything outside wala cheez. Skincare is not just about outside things also. It is all about what you do from inside on daily basis as a habit. Because see, whenever you're doing exercise, you are basically pumping a lot of blood in your skin, which will increase the oxygenation, which will increase the nutrition under your skin. It will improve your hormonal imbalance, insulin insensitivity. It will remove the amount of stress which is also responsible for acne, aging, and stress induced pigmentation. A lot of people get that also. So I think exercise is something which not only improves your skin from outside, it is visibly going to glow from inside too.
So does it also relate to BMI a bit? Because I was asked to reduce weight as well when I came up with my acne.
See, with BMI, I'll tell you, I'm 70 kg, and if you'll check my height, my BMI
Take it online.
Exactly. And the thing is,
It's the body fat percent.
it's a body fat percentage.
I think you mentioned about exercise increasing oxygenation. So antioxidants that we take, so would they basically instead of that, a better way to do it would be to exercise, right?
Exactly. So
And they serve the same purpose.
the market is full of antioxidants, but I'll tell you something, even if you pop up 1, 2 or 3 pills a day, which is containing a lot of antioxidant, people talk about glutathione.
Yeah, exactly.
There are a lot of products which contain antioxidant, but eventually the thing is, if your lifestyle is such कि आप सो रहे हो 4 घंटे, उठ रहे हो बहुत जल्दी, workout up कर नहीं रहे हो, you're smoking, you're having alcohol, these are the free radicals which will damage your skin eventually, and none of the antioxidants are going to help you anyways.
Are we the first generation who requires skincare, or it's a is it the pollution, the stress? Are we not eating good food? What is it? Why are we using skincare and not?
Totally agree with this. I'll tell you, when I was in my undergrad, when I was in my MBBS, I had no idea what is sunscreen, what is moisturizer. But frankly telling you, I think ours is the first generation which has to take care of their skin by using the skincare products also. It is not just ki skincare available hai, that's why you are putting it.
Yeah.
It is all these years, people, when we compare our generation with our fathers or forefathers, the kind of pollution that you have outside, the kind of processed food that you're getting outside, none of those things are safe.
What about ingestible skincare? That's a big trend.
I'm sorry.
Ingest like skincare you eat basically.
Okay, so
Like hyaluronic
the
acid
edible
or
kind of.
edible kind.
Like I was telling you, if you are deficit in B12, D3, if you have anemia, even that is going to impact your skin and hair. So everything that you're deficit in, you should consider it as a edible skincare. So even your B12 is going to work like a skincare for you. Your D3 is going to work like a skincare for you. Even your hemoglobin, if it is low, your iron supplements are going to work like a skincare. Because everything which is going wrong inside your body eventually will show up on your skin. There are a lot of women who comes with lip pigmentation around their lips, then they have pigmentation on their knuckles and all. This is all B12 deficiency. You put a lot of serum up, sab laga lo, nothing will work if your B12 is deficit. So I think edible sunscreen is important, but people should be aware about it कि कौन सी चीज नहीं है बॉडी में तो आपको ये symptoms आ रहे हैं.
Along with exercise, in my next visit, she'd asked me to do a detailed blood test. I was like,
I'm all fine. I want it.
no, like, why is a dermatologist asking me to do a blood test? Like, is there something wrong?
No, that's a very good way to go about diagnosing and treating.
If you're lacking in something, there are two type of kami which can be there. There can be insufficiency and there can be deficiency. If you're insufficient, me giving you a tablet will work for you because it was just a little bit lesser. But if you're deficit in something, means your levels are this much low. And if I'll give you one tablet which contains only this much of B12, you're lacking here. This much is what you're lacking. Then those tablets won't work for you. We'll have to give you injectables. So we need to figure out a data whether you're deficit or insufficient. So I always do the blood test.
At what age you think one should start skincare? Like, today I think that you look at teens and they're all out on social media. Like everyone's like, even with this, like you're probably like 10-year-old is walking with a lipstick in her hand. So,
so if we'll talk about skincare, everybody has this problem where people relate skincare with all the products. Like you have AM routine, you have PM routine, you're putting serum, you have this, that. The thing is, skincare is all about keeping the barrier of skin intact. Whether you're putting a moisturizer and sunscreen is good enough for you. I would say that for people who are beyond 5 years of age, we start moisturizer and sunscreen for them at that age itself, because there are kids who comes with they are born with the genetic condition of atopic dermatitis where their parents have been this dry skin ka condition since start from day one. So if you won't start doing it according to whatever is appropriate for their age group, if they'll start early on, they won't be having the same problems that their parents had. Like for kids, I would prefer to give them a moisturizer, good moisturizer for body and face, and then a sunscreen. At least 5 and above, I'll give sunscreen. 5 se below, at least I'll ask them to, as a parents, to apply moisturizer for them. And then coming to teens, abhi recent timing mein people are getting acne because their puberty ka time period is also reduced. Like girls are getting their menses at the age of 10, boys are getting their puberty at the age of 12. So that's why they're getting a lot of acne. So preventing your acne is a part of your skincare, along with the moisturizer, sunscreen that you're doing. Whatever is bothering you, whether it is acne, whether it is rosacea, all those things, unka treatment should be your skincare.
The baby segment skincare is now booming a lot more, not just for...
And we have a 2-month-old.
Yeah, exactly. So you're already putting moisturizers and...
It is actually required because there are so many kids who are getting atopic dermatitis since childhood. And it is basically a gene mutation where the water is not getting attached with the skin underneath. So आपका skin बचपन से ही dry होता है.
Oh, is that?
So that is actually a logical condition of atopic dermatitis. People are not even aware of it.
So is that gene mutation happening significantly?
So basically it is just a gene called as filaggrin gene which holds water under your skin, keeping your skin moisturized and hydrated. So if that gene is absent, your skin is dehydrated all throughout your life. Since you are a kid, you are in your teen and adulthood, say just pehle, your skin produces a lot of oil. That's why you are not able to see the signs and symptoms of dryness. Later on, you will start to develop eczema, you get dermatitis. So with every age group, the symptoms are different. So I ask these 4 questions from patients. So like, आपको मच्छर काटे तो निशान छोड़ के जाता है क्या? Do you get सर्दी खांसी जुकाम? Because all these things are features of atopic dermatitis. So then, because the patient will come to you in their 30s or like 20 to 30 के बीच में telling you कि doctor मेरा बचपन का skin has entirely changed.
Oh, yeah.
That is happening because you've been in atopic dermatitis since childhood. Since your skin is dry, you are more photosensitive, इसलिए आपके skin का पूरा color change हो जाएगा while you grow up.
And I have another interesting question which I think most new moms would love to know, because we had a lot of debate and a lot of conversations with our moms. Besan lagao, sab ho gaya. Coconut oil,
bathing with
iska
besan.
oil,
Yeah,
uska oil.
absolutely.
I agree that
To remove the hair and all for besan, right?
Just bathing with it also, but also the hair, the baby hair,
The hair, I think even the cradle cap.
Many nannies would say that, like rub that and I'll remove all this. And all that.
I'll give you a simple solution for that. So what happens is, जिस एज ग्रुप में आपके अभी मॉम डैड हैं या आपके दादा दादी हैं, वो अगर उनके बचपन में जाएंगे ना, उनके टाइम पे द काइंड ऑफ बेसन, द काइंड ऑफ आटा दैट दे यूज्ड टू हैव वाज वेरी वेरी प्योर, सो इट यूज्ड टू वर्क फॉर देम. बट लुकिंग एट current condition, no, the soil is all contaminated. The kind of atta that you're getting, whether it is packed, high quality, doesn't even matter, it is coming from the same soil. चने से बन रहा है, चने से आपका बेसन बनेगा, that besan is going to destroy your kid's skin. Even coconut oil, I should not name it, I'm sorry if it is controversial, beat me later. But the thing is, the coconut oil that you're getting outside, which are basically the oils that you've been using all throughout your life, they are also containing mineral oils. So mineral oil, if you put on your child's skin, it will cause irritation, it will cause rashes all over your body. So I prefer to ask them to apply cold pressed extra virgin coconut oil, which you have actually extracted maybe in front of your eyes, or you must have got it from Kerala. Kerala is more reliable regarding this.
So I would want you to throw some light on, like, the skincare in pregnancy overall, like, when we should start, and is it like the phase where you should give utmost importance to your skin because it's going through a huge transformation?
Even hair, I think, right? Skin and hair both.
See, basically what happens is people will talk about you'll have a pregnancy glow while you're pregnant.
Oh yeah,
but
that's the thing.
I think it is not true for everybody, because eventually you'll have a lot of hormonal surges during pregnancy. Your hair might be feeling thicker to you while you are pregnant. That happens because while being pregnant, you have a lot of estrogen which goes up. So if your estrogen is high, most of your hair stays in the growth phase. They are not going to fall off. If they are in the growth phase, they'll go thicker and thicker. But the moment you are in your postpartum phase, those estrogen levels will drop down to normal level, and then you will start to have a lot of hair fall. That is going to happen 2 to 4 months after you deliver the child. But what is the alarming thing is, it might be completely normal for you, but what is more alarming is when you have a lot of shedding even after 4 months, even after 6 months or 1 year of postpartum age, then you should be basically taking treatment. And while you're pregnant, I think more than the skincare and more and more products putting on your body, I would rather prefer to have a high protein diet, because your hair is made up of keratin, your skin is going to be nourished by a lot of protein underneath. Collagen is eventually protein. So while you are pregnant, focus more on the dietary advices that your gynec or your dermat is giving you. So have more of nuts, have more of omega-3 products, vitamin E containing products, then protein intake, instead of junking on the supplements that, I can prevent this. No, your diet will actually prevent you from there. Also during pregnancy, you will have a lot of melasma. You have a lot of acne flare up during that time. Your dryness increases a lot. These are normal things that people have. But more than that, if you get a lot of generalized rash all over the body, then you should be actually considering seeing a dermat. But regarding skincare, keeping it very clean, a physical sunscreen during pregnancy is actually safe. If you are putting a moisturizer on damp skin, it is going to help you minimizing your stretch marks per se. You can never prevent it because basically it is genetics, it is hormonal changes, and it is stretching of the skin which is responsible for stretch marks. But what you can do is minimize the effect of it later on.
Does that stay then, the stretch marks throughout, or do they automatically go away? Like, how does it work?
Nothing goes automatically, but while you are pregnant,
because that's what I've been told so far at home.
The thing is,
I think it's a big concern for a lot
everyone.
I would say that, but the problem is it's not just pregnancy. So while you're gaining muscle in your body, that's when you get the same kind of stretch marks. But if you moisturize your skin like thoroughly, like what I usually tell those pregnant women who comes to me is, half an hour before you take shower, you massage your areas everywhere with coconut oil, same cold pressed extra virgin coconut oil. Take cold shower, don't prolong your shower for too long. That will dry out your skin. That will make your stretch marks visibly more available, right? And then the third thing is, you should be using a moisturizing kind of a body wash or scented bar. Don't use any loofah, katha scrubs and all, because your skin is already very dry and damaged. And then at the end of taking shower, the moment you come out of shower, you put moisturizer all over the body on damp skin. That water is going to get absorbed with the moisturizer, going deeper, keeping your skin hydrated for longer time. And as you go in the postpartum, we have a lot of options to treat the rest of the things. Before that, just prevent it.
So you said the scrubs should not be used during pregnancy?
Not pregnancy. I would say you should never touch it in your life
Oh,
ever.
really? Oh, okay.
Yeah, because see, I told you, like I told her a lot of times already. She don't listen. I'll tell you the scientific reason behind it. Every 28 days, your cells are getting renewed altogether. So every day, if you're scrubbing your skin, now you're basically getting those immature cells being damaged. Your skin ka barrier is going to get damaged because every day some or the other's dead skin cell is shedding off. And while you are scrubbing your skin, you are damaging those naive cells who were just born and came on the surface of skin. That will make your skin even more darker.
Oh, okay.
There's a medical condition called as macular lichen amyloidosis related to just using scrubs.
Okay.
Loofah, katha, karate.
But I thought you
use a
just
lot
said
of
it on the
katha.
face, so I never used it on my face. So I thought it's better for your body overall.
No, it's the same thing, 28-day cycle.
I wanted to know about, you said it's okay to use moisturizer, sunscreen during pregnancy.
Yeah.
I want you to list down a few ingredients which are a strict no-goes during pregnancy that they should not go. And I want you to tell us the products which are okay because people have severe acne conditions.
Definitely.
I suffer with my own. All the regular
Do's and don'ts.
yeah.
Okay, so definitely everybody is so concerned about their skincare, especially during pregnancy, because everybody is not getting that glow while you're pregnant. But other than the moisturizer and sunscreen, I would prefer you should go for only physical sunscreen. No chemical sunscreen should be used. If you have acne, if you have melasma, pigmentation, if it is very severe, I think azelaic acid is one of the good component that we actually prefer during pregnancy. Even niacinamide, that is also very good for during pregnancy. If you have cystic acne, what we prefer to give is clindamycin, which is comparatively very safer compared to the other.
Yeah, actually, I think you've used it.
Clindamycin, yeah, you have it. So clindamycin is the safest one. Then azelaic acid. Azelaic acid is something that works on acne, pigmentation, inflammation, red acne, red pigmentation. It works wonderfully. It's one of the, one and all kind of a product that works very well. So these are the three products that you can actually use during pregnancy. And no-go is something that everybody knows about. I think it's retinol, oral retinol, topical retinol. Tezoretine is again a type of retinol only. Then benzoyl peroxide is a big no-no. Then you have salicylic acid. People are getting peels while they are pregnant. Salicylic acid peel, no. Why? You can just wait for next 9 months and then go for it.
But are these products okay once it's postpartum and breastfeeding, or are they still not allowed?
No, they are okay. But even while you are breastfeeding, I think some way or the other it is going to get excreted in mother's milk also.
Yeah.
So we prefer to avoid it even postpartum if you are lactating.
Okay.
So you think all the celebs walking into the Met Gala after pregnancy 4-5 months with clean, sleek body with
That takes a lot of effort. So many people are actually, so basically most of the people don't know about it, but post pregnancy these people what they are doing is they are doing abdominoplasty, where they just deliver the baby and they are going to extract all the fat underneath jo skin hai, and then they stretch the skin down and put the sutures over there. So that is why aajkal now there is a lot of money making in obstetrics also. People are charging 4 to 5 lakh rupees just to deliver the baby, and on table while they have delivered the baby, the abdominoplasty is done. So you are like this a day prior and you're like this a day prior. That's how it works. So then that takes a lot of efforts, right? People are not aware about it.
My thing was I used to stand in front of the mirror. I would look at my body and why am I not looking fit like one of those actresses? Because I kept working out throughout my pregnancy.
Exactly. So you don't have to blame yourself anymore.
Yeah, I would do yoga, swimming, ask him every single day.
Yeah,
I was
you've done yoga
super
every day.
active.
Literally the day before. Yeah. The day before you delivered, you were swimming. Yeah.
Still, I have those days where I just stand in front of the mirror and I cry because I'm not fitting into those clothes. I'm getting emotional right now. But
See,
okay.
the problem is rest of the body will eventually get fit because it has nothing to do with the stretching part. But your abdomen basically is like this, right? ऐसे है वो, वहाँ पे ऐसे layers हैं. When you are delivering a child, when your baby is growing inside you, that those muscles get like this. They get separated. We call it diastasis recti. Now your muscles have to come back for your core to get stronger. So instead of working in cardios and other things, no, work on the core. If you have a very tight core, your muscles will align together and they will get back to normal. So you won't have that postpartum pooch जो लोगों को यहाँ होता है. It's all those relaxed muscles that they never worked upon.
So everything is completely.
It's all about core strengthening. If your core is tight enough, your muscle will get back to normal and they'll go up
that
straight.
will typically take time, I think.
Yeah, if you're not doing the surgery, it will take time. Otherwise, if it is abdominoplasty, they'll just suture it back together, put it, push it, everything inside, and your next day you're all flat tummy. I'm like, इसको बच्चा इतना जल्दी कैसे ठीक हो गया? So people don't reveal these secrets, otherwise everybody will become a celebrity, which, it's bad for them. I always ask my patients, like, if they have come up with any other problem or hair fall problem, they tell me, doctor, don't give me such medication. I just recently got married and we are planning for a baby. I tell them, don't get pregnant for next 3 months until I check your blood test. We do blood tests for them to rule out any thyroid, any diabetes. We check their B12 level, D3 level, because eventually what is going to happen is once you get pregnant, in starting 3 months, you won't be able to eat anything. So whatever deficiencies which are there before you got pregnant, they'll become even more worse. And the sign eventually will be seen to you postpartum. Because 9 months में आप ना सप्लीमेंट ले पा रहे हो बाहर से कुछ, ना आपका कुछ और जो भी कमी हुई है, ना आपको आयरन का इंजेक्शन जा पा रहा है, सबको नहीं जाता है. And then you will never be aware of it. So during pregnancy, post pregnancy में घुसने से पहले ही I just make sure that my patient is all covered with all the supplements that they are deficit in.
Straight from the doctor, I want you to simplify a skincare routine, a basic skincare routine, because I'm a breastfeeding mom. I hardly get a couple of minutes for myself sometimes because so much running around. Pregnancy, you still have time, but I think it's more or less the same.
I think more difficult.
Yeah. So is it even important? Because most of the times you're at home, and I think people say that you don't really need anything because, sunscreen again, you don't put it when you're at home. So I want you to just give me a basic.
While you take shower, cleanse your face with a cleanser. The moment you come out of shower, you put a moisturizer, you put a sunscreen. If you're not putting any other serums and all, that's all. It won't even take a minute. Most of the mothers that I meet, they'll be like, doctor, we don't have time. We are running behind the child. It won't take a minute even. And while you are sleeping, just 5 minutes before you sleep, you do your skincare routine again while you have made your child asleep. Just wash your face again, put a good moisturizer, and that is all you need to do. Itna bhi aapne consistently maintain karke rakh liya, it will help you a lot. With the hair, again, if you don't have dandruff, put oil half an hour before you take shower, put a good shampoo, put a good conditioner, and that is all you have to do. More of it will come from the diet that you're eating.
And my husband's favorite, another myth or a real thing you have to tell us, that is ice dunk facials, basically dunking your face in the eyes.
Frankly,
I just saw her doing it a few days ago and I was like,
what are you doing? Why are you doing this?
So ice dunk facials actually came from people who put a lot of makeup on their face because they don't want कि makeup के through उनके pores visibly बाहर दिखें. So when you are basically dunking your face in ice water, it will make your pores shrink temporarily for some time so that the makeup is going to glide on your skin without any visible pores outside through the makeup. So that's what that's how it used to work, but it has become so trendy that everybody around you are doing this. If you want to waken your skin up, if you want to have that blushed look, then you can just put ice water or you can just rub, and that is what it'll give. Basically it causes vasoconstriction. Vasoconstriction, आपके blood vessel जो हैं वो shrunk हो जाएंगे. Yeah, so that's why your pores also get shrunk. But mind me, the thing is, when you put a lot of ice on your face, it also dehydrates your skin, making your pores look smaller, but eventually making the oil production to come back all over again. And it also damages your skin ke niche ki choti choti blood vessels, which are very minute and which are very temperature sensitive. So I think for me, if you're using it on daily basis just because it is going to give you that flushed look, it's a big no from my side. If you're putting makeup once in a blue moon, it's fine.
Lovely. And another, I think this is a big trend. I think all the brands are coming up with this. Collagen supplements actually work or not?
Okay. I personally...
My husband will hate me for asking me this question, but please go ahead.
So I've been taking collagen even before collagen was a trend. I started taking collagen in 2018. There was this particular brand which I was fan of. I just got to know about it from one of the dietitians. She's in Dubai right now, Rashi Chaudhary. I don't know whether you guys have heard her name or not. But yeah, she recommended that. And so I started taking it. It was not available in India. But I took it for straight away 3 months and it actually worked. But if it will improve your skin elasticity, it will make those fine lines go away. But eventually it is all about consistency. If you'll take it regularly for 3 months, then only it will work. If you are a smoker, you will not see any result. If you have a diet which is more of inflammatory diet, having a lot of junk, having a lot of sugar, collagen might not help you. So it will help only those people who are also supporting that collagen. Right? Not for everybody.
It's essentially a supportive therapy.
Exactly. And that supportive therapy will work only when you are also supporting it.
Okay, then I think a similar product is again a similar supplement. Sorry, it's glutathione. I want you to deep dive into glutathione a bit.
Now. Bridal glows, everything.
Yeah, I mean the glutathione tablets, how it not just your skin, I think it goes beyond. I want you to talk a bit about how and what it does.
See, why glutathione became trendy is because people talk about glutathione कि उससे आपकी skin 2 shade light हो जाएगी. But that is not the reason I give glutathione to people. I love that molecule. It's a very good antioxidant, super good. But I never give it for this reason कि आपका shade 2 shade light हो जाएगा. अगर patient ये बोल के आता है कि डॉक्टर मुझे गोरा होना है, हमें injection लग, we also give glutathione के injectables है. But I don't give it to them with this intention कि आप गोरे हो जाओगे. Because the moment you will stop the supplement, you might go back to the same situation again. I prefer to give them glutathione just for the sake that if you have any free radical damage in your skin, if you've been your skin has been damaged because of sunlight or any other reason, we can repair it by giving you antioxidant as again a supportive therapy. I never give it with the intention that it is going to lighten your skin.
All the industry experts, everyone's talking about this particular piece, which is AI. And I'm sure a lot of patients come with like, okay, this is what I saw online. Is it like, earlier it was Google and now it's ChatGPT, which you just probably put a picture and it's probably, it's more promising than the Google. It gives you more accurate, personalized version of an answer. So, where should people draw a line between, really believing in what it's saying and actually going to a dermat and,
Okay, so considering the current generation, everybody is a Google doctor. They will come up with a doctor, mujhe ye ho raha, they'll come up with the diagnosis with a particular word. I have this thing, like even if it is a chota sa freckle, they're like, ChatGPT just told me that I've got skin cancer. What should I do? I was like, I love this section where people come up with so many diagnoses with Google and AI. I tell them, you know what? That is the reason we don't ask you to try Google AI, because you'll be stressed out all throughout the day until you see a doctor. The thing is, AI, ChatGPT, they are very good for education. You should acquire as much knowledge as you want. You should be going through it so that you can ask questions from the doctor which you are not aware about any topic. But using that as a diagnostic tool and then using medication according to it, आपको क्या लगता है आपका ChatGPT, AI सब कहाँ से आया है? How did they got their knowledge from? This is from all the articles which the doctors have actually published, right? So they don't know more than the actual doctor knows. जो चीज AI को सिर्फ एक फोटो में 2D में दिख रहा है, that doctor is going to see it सामने से. They will examine it with so many tools and all. And एक single lesion जिसका diagnosis आप एक single दे रहे हो, we have thousands of differential diagnosis for that. And we are going to explain you each and everything.
Very true.
So it's not like AI सिर्फ फोटो देख के आपको ये बताएगा कि ये हो सकता है, बाकी तुम देख लो, मुझे नहीं पता.
Skincare was only limited to females earlier, like, from past many years. Now, how do you see it changing, and probably men also getting involved, and like, men coming with, problems of acne, want to do microneedling, chemical peels, they want to look good. How is that changing, and like, is it changing or not?
Of course, definitely. I think if it'll come to millennials, which I belong to, millennials are always judging themselves to use any kind of skincare product on themselves, because this is something that they have been taught through their fathers or forefathers कि अरे कुछ नहीं होता, acne आता है चला जाता है, why do you need all that? But I think it is Gen Z and the upcoming generations beyond them, they are so self-aware or hyper-aware of everything because of social media that they want to try everything, and they don't care about what people are going to talk about it, because eventually it is all skin has the same structure which a male and female has. सो आपका स्किन बॉदर्ड नहीं है कि आप मेल हो कि फीमेल हो, वो सेम ऑयल प्रोडक्शन नहीं प्रोड्यूस करेगा जितना मेल में होता है उतना. इनफैक्ट मेल में ज़्यादा ऑयल प्रोडक्शन होता है बिकॉज मेल हैज एंड्रोजन हार्मोन विच बेसिकली स्टिमुलेट्स ऑयल ग्लैंड्स. सो whether you're a male or a female, you have to do a skincare, and don't keep it complicated. If you keep it simple, it will still give you the results which you want to have. Not like female, like 10 products से कुछ नहीं होता, whether it is male or female, but everybody should have a basic skincare routine. ऐसा नहीं body का साबुन चेहरे पे लगा लिया. There was this one patient who came to me and I was like, चेहरे पे क्या लगा रहे हो भैया? उनका चेहरा पूरा dark हो रखा था and there was too much of roughness on the skin, acne आ रहे हैं. He was like, madam, rinse sabun. And I couldn't believe myself, and I told him, huh? And then he said, हाँ मैडम, rinse साबुन वो बॉडी पे भी लगा लेता हूँ, फेस पे भी लगा लेता हूँ.
Hey guys, thank you for watching our podcast. We love bringing in skin content for you guys, reliable, straight from the dermats, renowned dermats from Mumbai. If you liked our content, please share, like, and subscribe. And please share with us in the comment section if you would want to know about a particular topic, particular skincare problem. We would love to get our partners, dermat partners, on board and share their thoughts with you. Thank you so much.
Thank you.